Imagine every night while you're asleep, you stop breathing. Not just once, but hundreds of times throughout the night, your breathing is interrupted. Your airway becomes blocked, causing you to gasp for a much-needed breath. It's hard to imagine, but millions of people suffer from this condition called obstructive sleep apnea. Sleep apnea is a condition in which your breathing stops during sleep due to a collapsing airway. These persistent breathing obstructions can severely disrupt your sleep patterns and cause excessive sleepiness or fatigue during the day. But that's not all. Sleep apnea has been associated with hypertension, heart failure, stroke, and diabetes. Even harder to imagine is the fact that many people suffering from sleep apnea don't even know they have it. The standard method to determine if someone suffers from sleep apnea is a sleep study. This is a simple diagnostic test that monitors your breathing, oxygen level, and other vital data while you sleep. If you are watching this video, your physician has recommended that you have a sleep study. The StarDust2 portable diagnostic system is an easy-to-use device that enables you to perform a sleep study comfortably in the privacy of your own home. Allow 5 to 10 minutes before bedtime to assemble the device. Depending on how your provider configured the StarDust2 system, the components may include the StarDust2 pouch, the StarDust2 recorder, which stores the information collected from the sensors, the respiratory effort belt, which monitors chest movements as you breathe, an airflow sensor and cannula, which monitors airflow from your nose or mouth, and an SpO2 sensor, which measures the amount of oxygen in your blood and your pulse rate. The user guide also may be included. The StarDust2 operates on a 9-volt battery. If the battery is not pre-installed, please contact your provider or refer to your user manual for appropriate instructions. Let's begin the step-by-step instructions for how to operate the StarDust2. First, place the cord of the pouch over your head and around your neck. Adjust the length of the cord so that the pouch hangs down in the center of your chest. Then place the StarDust2 recorder in the pouch. Next, place the respiratory effort belt around your chest. Make sure that the belt passes through the belt loop on the back of the pouch. Then, connect the two sides together by snapping the tongue of the belt into the buckle. If the belt needs to be tighter, simply pull on the loose strap until the belt fits snugly. Your clinician may have provided you with either a pressure-based or a thermistor airflow sensor. We will first review the pressure-based airflow sensor. If not already connected, connect the black sensor into the nasal cannula. Insert the airflow sensor prongs into your nose so that they are bent toward you. Run the tubing on both sides of the prongs back and over your ears. Now secure the tubing under your chin. If you have a thermistor-based airflow sensor, place the airflow sensor under your nose with the two small wire loops in the air path of your nose. Make sure that the two small wire loops are bent outwards from your face. The large wire loop should be in the air path of your mouth. Run the wire over your ears and secure it under your chin. To keep either airflow sensor in place, tape the leads to your cheeks. Make sure that the sensor leads are tight enough to prevent slipping, but loose enough that you can still open your mouth. Now, apply the SpO2 sensor. Your clinician may have provided you with either a Y sensor or a clip sensor. We will review the Y sensor first. If you are right-handed, apply the Y-style sensor using the provided tape on a finger of your left hand. If you are left-handed, apply it to a finger on your right hand. Place your finger on the tape. Position your finger so it aligns with the image shown on the tape. Now, fold the sides of the tape around your finger. Next, make a fist and tape the sensor cable to the back of your hand. Release your fist. Place the sensor cable up your arm and secure it in place with tape, so you are able to move your arm freely. If you have a clip-style SpO2 sensor, simply place your finger inside the sensor. Next, make a fist and tape the sensor cable to the back of your hand. Release your fist and place the sensor cable up your arm. Secure it in place with tape so you can move your arm freely. Next, remove the StarDust2 recorder from the pouch and turn it on. Wait until the green light appears before placing the recorder back in the pouch and closing the flap. Once the StarDust2 recording unit is turned on, do not turn it off until the end of the study or at the time specified by your provider. Notice the purple button located on the front of the StarDust2. Pressing this button will let your provider know when you are ready for sleep and if you are up during the night. Press the purple button. You can now go to sleep. Your provider may advise you to press the purple button at additional times, such as when you get up at night to go to the restroom and when you return to bed. When you wake up in the morning, you'll be done with the study. Remove the StarDust2 from the pouch and turn off the device. Next, remove the sensors. Return the system to your provider according to the instructions you were given.